Everyone, we'll just get started in 1 minute. We're just waiting for media to be able to join the call. Good afternoon, everyone. My name is Sharon Bogan from Public Health Seattle in King County. Thank you all for joining us today for this telebriefing. The purpose of our briefing today is to share updated information about the latest status of COVID-19 spread in King County. Our speakers today are King County Executive Dow Constantine and Dr. Jeff Duchin, Health Officer for Public Health Seattle in King County. Both of our speakers have a few words to share with you all, and then I'll be taking questions from news media after their comments. I'd like to limit your questions to one question because we have a hard stop at 2 o'clock, and then if we have time, we can go back for follow-ups. I'll ask you to use the raise your hand function in the Zoom chat to ask your questions once our speakers have concluded. So with that, I will turn it over to you, Executive Constantine. Go right ahead.
Thank you, Sharon. Thanks, everyone, for joining us this afternoon. Yesterday, Dr. Duchin and I and other experts from public health held a teleconference with more than 400 community leaders, leaders from business, from community groups, from local governments, all of that to underscore the importance of collective action against the virus and really to call people to action, to speak with one voice as a community as we seek to keep control of the pandemic here and allow our economy to continue to recover and people to continue to be able to try to put their economic lives back together. You know, before those on the call heard the perspective of young people, before they heard the perspective of young people from the Washington Bus and the Vera Project, I went ahead and asked if they would be these local leaders, kind of public health ambassadors, people who are influencers for their customers, their employees, their clients, their partners. This is vitally important now. As we see troubling rise in cases, especially heading into this July weekend, the residents of King County have responded magnificently over the course of this challenge, and I want to call on them to do so again. I want to affirm that going through phases set out by the state was not about a return to normal. It was about expanding economic activity in a measured way while still trying to keep control of the pandemic. We still need to limit activities. We still need to limit behavior. We still need to limit unnecessary interactions. And I think that in general, people understand that, and we just have to keep getting a consistent message out that danger has not passed. But if there are those businesses in particular that are simply not willing to join the battle against the pandemic, we will enforce the rules through any channel available, whether it's through city regulations and their controlled business licenses, or the State Board, or Labor and Industries, or even through King County Public Health and authority created by our Board of Health. And we will do that in order that the vast majority who are playing by the rules and trying to help control this are not undermined by a few bad actors. I hope very much that will not need to happen. The last thing we want to see is for this thing to race out of control and for us to find ourselves in the position that Texas and Florida and other places are now finding themselves where they go backwards. Where they have to go backwards into a lockdown, where they have to close down businesses that had previously been allowed to reopen and deprive people of the ability to earn a living, keep a roof over their heads, and keep food on the table for their kids. We would hope instead that everyone will answer the call to unite in keeping a lid on the virus while allowing the economy to continue and the rest of our community to continue to recover. We have to do better if we're going to be able to really control this thing over the long term while we rebuild our economic lives and lives of our community. If we want people to be able to go back to work as quickly as possible, we have to do better in controlling the virus together. If we want our kids to be able to get back to school or to college in the fall, we have to do better together. If we want vulnerable individuals in our community to be able to stay safe and stay healthy, we have to do better together. Yesterday, I had President Kause, Anna-Maria Kause, University of Washington, join our cabinet to discuss the work the University of Washington is doing in the face of this virus. And we talked about the outbreak on Greek Row and about the challenges it faces and how that it poses, but also how it's a bit of a wake-up call before young people are potentially returning to campus en masse in the fall. Young people have heard over and over that they are less vulnerable, that they're less likely to die from this disease, and somehow that has turned into, I don't need to worry about this because I'm not going to be harmed or I'm going to die. We have to change that narrative. Young people are no less likely to catch this coronavirus than anyone else. While they themselves may be less likely to die, they're very likely to infect others who may in fact be among those who are most likely to die. And they themselves can suffer long-term consequences, health consequences from this, even if it doesn't take their life. Before I turn it over to Dr. Duchin to explain what he's seeing in the community, I want to emphasize again the need to take stronger steps so that we can continue to reopen, to rebuild our economy, people's individual economic lives, and get back to normal as quickly as possible. This community has shown that it has the ability to take collective action to manage the crisis. And by having individual actors get the message out, whether it's through the media, whether it's through people's individual networks of contacts, of influence, we all have to be singing from the same song sheet, which is this is far from over. It's far from over. We have to take every precaution to prevent the pandemic from resurging in a way that we cannot control. With that, I want to turn it over to our public health officer, Dr. Jeff, or I'm going to get back to you, Sharon. You can introduce Dr. Duchin.
Thank you very much, Executive Constantine. Now to turn it over to our health officer for Public Health Seattle and King County, Dr. Jeff Duchin, last name spelled D-U-C-H-I-N. With that, Dr. Duchin, go right ahead.
Thank you, Sharon. Thank you, everyone, for joining. After good success with our stay-at-home strategy, the average number of cases over the past week has increased from 40 a day during the first 2 weeks of June to over 100 a day. Most, but not all of the increase is among younger people. 1/3 of recent cases in the past 14 days are in young adults 20 to 29 years of age, and over half of all new cases are between 20 and 39 years. Approximately 40% of the cases in this age range over the past 2 weeks have been in Seattle residents, although we're seeing cases throughout the county. As you know, there's a large outbreak in the University of Washington Greek system students. Now, it's good that younger people with COVID-19 are less likely to require hospital care. And at this time, our healthcare system has not seen a corresponding increase in hospitalizations or deaths. And yesterday I convened healthcare system leadership and confirmed that they have robust surge capacity, and they are also actively monitoring the situation, and we will keep in close communication. But because infections can spread from this predominantly younger group to older community members and persons with underlying health conditions who are at risk for severe disease requiring hospitalization, we are closely tracking our healthcare system status. Now, this recent surge in cases seriously threatens both our health and the progress we've made reopening our community. We all need to understand we own this. We need to step up our COVID prevention game big time right now in every aspect of our lives to avoid going backwards. This means more distancing and fewer close contacts and fewer gatherings outside the home, which is our most effective tool, along with more face mask use. Hear this, COVID-19 would love to meet your friends and family this 4th of July holiday weekend. Don't let it happen. Don't bring COVID-19 to or home from your celebration this weekend. COVID-19 isn't taking the weekend off, and the need to protect ourselves and others can't either. We want to keep the economy moving, not the virus. Our challenge is to manage COVID-19 over the long term, in the zone between total shutdown and letting the virus run wild. We need everyone's help in making the long-term fundamental changes in how we go about our lives beginning today. Limit close contact with others. Avoid group gatherings. Wear a mask and wash your hands. We depend on each other to prevent COVID-19. With that, I'll turn it back to Sharon for questions.
Thank you very much, Dr. Duchin. And to reiterate for media, please use the raise your hand function and we will call on you. Please also state your name and your media outlet. And with that, I will go ahead and start with C.E. Blick. Go ahead.
Hi, yes, it's Carolyn Bick from the South Seattle Emerald. I wanted to ask, and I don't mean to sound, crass or anything like that, but these are messages you've given before with regards to, please wear a mask, social distance, everything like that, and yet, even after the governor issued a mask mandate, I still see very few people out and about. Since the numbers, apparently show otherwise with regards to mask wearing, how can you kind of convince people that this is really important and that they really do need to care about others, through voluntary action rather than a county-wide mandate that actually has teeth?
I'll start, if I may. First, it is particularly important that people wear masks when they're in an indoor setting, a coffee shop or a restaurant or a grocery store. And if they're outside but in a group setting where they're not able to maintain a decent distance, it is not critical that people wear a mask when they're just out walking around the neighborhood. And so I see a lot of folks out wandering around with masks and at first you're alarmed, but the fact is that it is reasonably safe to do that. So for the situations where people are in close contact, where they're indoors, where they are required to be wearing a mask at this point, where the businesses are required to have them wearing a mask, we need to establish very clear community standards that this is expected. And you are expected to be wearing a mask for the protection of everyone. It's not a courtesy. It is a requirement, and it is something which, if you're not wearing a mask, you should be able to be excluded from the store, the coffee shop, the restaurant. I'll let Jeff weigh in a bit more, but because I'm a layperson speaking about this, he's a public health expert. But I think that the time for us to consider this to be a purely personal choice, a matter of preference, is behind us now. We need to be considering this an absolute expectation of every resident. Jeff.
Yeah, thanks for your question. A couple of things. First of all, it should be clear to everyone that our most potent tool to interrupt COVID-19 transmission is distancing from one another. Mask use is an important adjunct. We know we can't shut down our society long term. We need to have some contact with one another, and therefore we need to have a layered approach to protection. We need to minimize our contacts. We need to minimize our duration of contacts. We need to contact one another in spaces that are well ventilated, and we need to use masks for an added layer of protection. There shouldn't be a false reliance or overassurance that masks alone mean people don't have to do distancing or limit the number of contacts or limit the proximity of their contacts. We need to do all of this to minimize the risk. As for a mandatory versus voluntary, we really believe that people need, with the right information, will do the right thing to protect themselves, their loved ones, and our community. And this is a fundamentally big change that we have to understand will be long-term. And so it's understandable that it's taking a while for people to adopt this behavior. And perhaps there was a false sense of security when we moved forward into phase 1.5 and 2 that the risk had decreased. And what we're here to tell you now is the risk is not gone, it's high. And we need to take these prevention measures seriously, dead seriously. So mask use, distancing, hand washing, decreasing the frequency and intensity of our gatherings, all of these things are the only things that are going to allow us to move forward with our economy. We have to be able to operate between the zone of total shutdown and the zone of virus running wild. And the only thing that's going to allow us to do that, and the extent to which we can do that, is our own behavior. And so we're here to tell you now, please be more serious about this. Please do a better job. We understand that you can, we believe that you can, and we must.
Thank you. Now a question from Amy Moreno from King 5.
Okay, yeah, thank you guys. You know, the timing on this kind of comes as we're going into this holiday weekend, which unfortunately in our culture is just synonymous with barbecues. We had the situation in Snohomish County recently where they're trying to now get in touch with, you know, the 70 people that were at a house party. Can you talk a little bit about what you're doing ahead of this weekend to try to keep people from gathering, and just another maybe appeal to people? It seems so easy just to say, I know these friends and family, I'm sure nobody in this group is sick, but just some final words to really discourage those gatherings, even house parties, you know, by chance for this holiday weekend.
Jeff, do you want to, well, I'll just say, based on the rapid increase in the number of confirmed cases, there's a pretty decent likelihood that if you're going to a house party, somebody there's going to be infected. It's not certain, might not even be 50%. There's a decent likelihood. And if it happens, you're putting yourself at risk, everyone else at that party at risk, and everyone they then go and interact with at risk. And ultimately, you're putting our economic recovery at risk, which is absolutely critical for so many people who are just hanging on, trying to get through this thing. So it is an act of community solidarity to avoid parties or gatherings, particularly indoors. But it is also important for your own health and your own self-preservation that you do not take lightly the notion that there's a rapid increase in infection going on as a community. Jeff.
That's absolutely right. The risk is high now, and this is one of the reasons we're talking to you today. We want people to understand going into the July 4th weekend that the virus isn't taking the weekend off, and we shouldn't either. We need to double down on the prevention methods, and that means understanding that there are asymptomatic people who have not yet become ill, who can spread this virus. They can be at any type of gathering at any time. And we have been discouraging gatherings, and it's especially important now for people to understand that the risk of these gatherings has increased. Our community is seeing more cases. And so to the extent that gatherings were unsafe a month ago, they're even less safe today. And so we really want people to understand the risk and the consequences with respect to what our community is going to have to go through if transmission continues to increase and spreads to those who are more vulnerable. So going into this July 4th weekend, again, you know, the virus isn't taking the weekend off. We need to double down, step up big time with our prevention measures. Don't bring COVID-19 home or to your 4th of July activities, and limit the number of people you're in contact with to limit the spread to everyone.
Thank you. A question from Steve McCarran. Go ahead.
Hi there. Thank you both for your time. This is kind of just on piggybacking of Amy's question. Is it really that people should just be staying home this weekend, this holiday weekend? I know that we've been talking to a number of people that are still planning to travel, still planning to meet up in small groups with family members that they're close to, but is the message for people just to really stay home?
To the extent possible, the message is to avoid contact with others outside of the family. And we understand people will want to get together with small groups, but the smaller, the better. You know, we're not going to be out arresting people for having gatherings, but we certainly are discouraging it. And we're discouraging large gatherings in particular. Right now, in the phase that we're in, gatherings of 5 outside of the family are permitted. But we're not encouraging that. We never encourage people to get together. This has always been limit your activities to the extent possible. And we want to raise the red flag that the risk now is high of these types of gatherings. Certainly large gatherings present a particularly high risk. Gatherings where there are older adults or anyone who's got an underlying health condition presents a particularly high risk. And everyone can come home from that party incubating COVID-19 and spread it to someone who's at particularly high risk, a loved one, a parent, a family member, a coworker, a colleague, a community member. So we really are depending on people to use good judgment, common sense, and please limit your interactions, decrease the risk over this holiday weekend.
Thank you. A question from Anna Boyko-Ryrock. Go ahead, Anna.
Muted.
Okay, unmuted now. Hello. Hi there. Question for Executive Constantine. I've been talking to a lot of community health organizations, and I'm hearing that poverty is a real barrier to preventing the spread of COVID-19. And people are saying they're afraid to get tested and to stay home and isolate because they're afraid they won't be able to pay rent and buy food. As the cases rise, are you going to commit more money to help people isolate and quarantine themselves?
The answer to that is yes. We've, of course, provided quarantine and isolation space as well as recovery space in facilities around the county, and we've sometimes done so with local support and sometimes with local concern being expressed. But also, I have sent out pre-COVID measures, budget measures to the county council, much of it allocating the federal funds that have been provided for this. And we will continue to identify the ways that we can help people be able to take leave from work, stay at home, avoid infecting others, and themselves recover, because that is good for them individually and good for the community. I return to this issue of our economic recovery. I mean, this is not just about the economy or about businesses or corporations. This is about the individuals you're talking about who are struggling mightily. And when each of us takes the responsibility to prevent the disease from spreading, we are taking a step to helping people get back on their feet economically as well as avoid becoming infected. So the answer is yes. We'll keep working with county council to try to put in place measures to keep a roof over people's heads and make sure that they're not compelled to go out in public while they are showing symptoms because of their dire economic straits.
Sharon, before we go on, can I add a comment to the last question about gatherings and activities? I mean, clearly, thanks. A question about, the risk related to family gatherings and activities over the holiday. When these do happen, it's critical to still remember to take the distancing precautions. Maintain distance, be outdoors, and wear a mask if you're going to get together. But if you really want to take the risk seriously and decrease the risk to yourselves, to your family members, to our community, don't gather or gather in small groups. But when you do, make sure you take the social distancing, the physical distancing precautions of 6 feet, well ventilated and preferably outdoor spaces, and mask use, good hand hygiene. Don't share utensils, don't share objects, don't pass things back and forth, because you're passing that virus around as well.
Thank you. A question from Asia Fields from Seattle Times. Go ahead, Asia.
Hi, so in light of the Greek row outbreak at UW, I'm wondering if you could talk about what guidance you're giving colleges, especially as they consider potentially reopening, and whether you're suggesting that they enforce social distancing and mask wearing, and if so, how you recommend that they do that.
Thanks for the question. There are guidelines for safe reopening, both at the federal CDC level, which just put out some new guidance, as well as at the state level. And we've shared that widely. There are a number of recommendations similar to what we've been talking about today, because the simple things that we have are applied in any setting. It's about distancing. It's about decreasing face-to-face interactions, avoiding group gatherings, wearing masks. And so each facility, each university, college setting, school setting needs to understand how to do that most effectively and how to reduce the risk most effectively. The outbreak at UW is very concerning. It does make us worry about what might happen this fall. We understand that there was a lot of socializing, a lot of risk-taking, not a lot of mask use going on. That's what we're here to talk about today, that when you do that and you don't take precautions, you get a lot of COVID in return. So to the extent that as a community, we can double down and show that we can do better, we'll be able to move forward more effectively when schools reopen. To the extent that we are not able to adopt the necessary precautions to prevent transmission, it's going to be very difficult for schools or any other place, businesses or workplaces where people gather, to operate successfully while allowing our healthcare system to avoid being overrun. So we need to walk that balance between shutdown and out of control COVID by taking precautions in any setting. And we really are talking a lot about social settings today, but this is equally important in workplaces, in retail, in recreation, and in any organized event where people are getting together. And we're especially concerned about activities where people may spend more time together or without masks. And bars and restaurants, as you know, have been associated with a large number of outbreaks across the country. We don't want to see that here. We need our restaurateurs and our tavern owners and our pub owners to be extremely vigilant about COVID safety precautions, because their customers are among the most vulnerable. They're getting together for a longer period of time, and they're not using masks while they eat or drink.
Thank you. Rachel Abrams, go ahead.
You're muted.
Rachel, did you have a question?
Can't hear you, Rachel.
Okay, Rachel, we'll come back to you, and we'll take this question from Steve Higgins. Go ahead, Steve.
Hey, sorry if you can hear me or not.
We can. Go right ahead.
Questions, but I guess I'll just focus just one for Dr. Duchin. So clearly the message is no big gatherings, but it's awful. It's going to be awful difficult to share that message also with those who are defying those orders and planning to hold their own protest, whether it's for the 4th of July or some of the other racial inequality and other issues that we've seen across Seattle and across the state. So what, if any, advice can you share with those who hear your message but still feel compelled to hit the streets and protest for what they believe?
Well, first of all, thank you for your question. I hope they hear what's happening in the community, understand what's happening, and of course, the communities that are being most impacted by COVID-19 are those for whom we're all in support of right now with respect to racial equity and justice. But there is a risk also that's coming with the gatherings. And so we hope they weigh that risk very carefully. We certainly are not encouraging gatherings right now as this outbreak is taking off. It's a very different situation than it was a month ago. So if it's something that has to happen, any type of gathering, whether it's a small barbecue or a gathering to protest systemic racism, we must take precautions. And that means distancing, mask use, good hand hygiene, avoid face-to-face contact, shouting, yelling, speaking loud, singing, chanting, all increase the risk. And we don't want anyone at any gathering to develop COVID, and we don't want anyone at any gathering to share COVID with their loved ones, their family, or their community. And we know that those communities that are suffering most at this time are those for whom these protests have been held on their behalf. And so just encouraging everyone to weigh the risks and benefits and know how to protect yourself if you must gather.
Again, and we'll take one final question if we can get Rachel Abrams' audio going. Rachel, are you there? It looks like we're having some difficulties there. So with that, I'd like to wrap up, but just wanted to ask Executive Constantine if you had any final words, and then Dr. Duchin, if you had any final words before we close.
Say this is not just a reminder of what we have said before and really for many months. This is ringing the alarm that this thing is on the march, that it's coming back, and we have a chance as a community to stop it in its tracks and to allow our economic recovery and people's individual economic recoveries to continue. And it is within our power collectively to do that. We can go down the path of places like Texas and Florida that let it get out of control, and now they are at its mercy, at the mercy of the pandemic. Or we can take the responsible path of each of us making the right choices and us collectively doing the things we do to support one another, so we can make this a one-way trip of lockdown and back into prosperity while keeping people healthy. Let's do that.
Thank you, Executive Constantine. I would just add that this is a terribly difficult time for everyone. This is an unprecedented pandemic, and we all need to take ownership over the consequences of our behaviors and our actions. We must move forward, and the extent to which we move forward is directly related to how well we adopt COVID-19 safety behaviors, separating ourselves from others to the greatest extent possible, wearing masks, avoiding prolonged contact, increasing ventilation. We need to step up big time and do better, because we want to do better as an economy, we want to do better as a community, and we want to be able to move forward. This is trial and error. There is no playbook for COVID-19. We're learning as we go, and we want our community to do the best it possibly can, both on the health front and on the economic front. But we get what we get, the result that we get depends completely on the actions we take as individuals and as organizations, as businesses, and as leaders. So at this time, we're getting a wake-up call that is the result of our inability to do what we should be doing more thoroughly, which means staying apart from one another, wearing masks, just doing a better job all around. I believe we can do more safely, but we need to show it.
Thank you. And I'd like to thank the media for joining us today. You all are critical partners in being able to get these messages out to our community. So we so appreciate your continued focus on this, your continued reporting on this. If you missed any portion of this, we will be uploading the video to our Public Health YouTube site, as well as putting it into our recent blog post on Public Health Insider, so you can access the video there. And with that, I just want to wish you all a very safe and healthy July 4th weekend. Thank you all for joining.